Okay, thank you very much for the opportunity to give this lecture through Zoom, and I apologize that I cannot be with you. My name is Ravid Doron. I'm from the Open University of Israel. My lab is develop a new herbal treatment for depression and anxiety, and I want to share with you some of our research. We are living in a very stressful world. In Israel, many people do not know where the loved ones are, and everyone is under tremendous stress right now. Many people suffered from anxiety and depression. In the USA, 70% of the population suffered from anxiety and depression. It's meaning a million of people. To be clear, I put in the same package depression and anxiety because more than 50% of the symptoms in these two diseases are similar, and the medical treatment is the same. There are some options for treatment depression and anxiety. In this lecture, I will focus on the drug options. The popular drug family which can safely use for the long term is the selective serotonin reuptake inhibitor, the SSRI. This family of drugs increase the brain serotonin level, but the impact of these drugs will only show after 3 weeks or 1 month of daily use. Moreover, SSRI can help 50% of the population, and as you know, many drugs have also has side effects, including SSRI drugs. There are two commonly reported side effects: decreased libido or sexual behavior, and weight gain. And because of these side effects, many people stop using these drugs and try to find an alternative. During the last year, two interesting articles were published. The first one was published in Biological Psychiatry by Horvitz et al. They made an umbrella review, and they reported there is a limited evidence that serotonin is involved in depression. Another article published in PLOS ONE by Muhammad et al. Followed 70 million Americans who suffered from depression, and this article did not found that those who got treatment with SSRI reported a higher quality of life than a patient who received placebo. From all of that, there is an incentive to find a new direction for treating depression. In my lab, we try to find a new direction for treatment depression and anxiety, and we look at the Chinese herbal treatment. All the herbs that we work at were a herbal dietary supplement approved by the FDA and by the Israeli Ministry of Health. Initially, we work on a herbal mixture that include 4 herbs. We investigated this mixture and found it treated anxiety and depression very well. From the mixture, we separate one dominant herb. The name is Cartagus panatifada. Their Chinese name is Shanza, and I call it Chinese apple. This apple contains a high level of tryptophan, the precursor that the body used to create serotonin. And because it was a herbal supplement, we can use it in human experiment. But we were afraid of placebo effect. So we decided to use the Cartagus panatifada on the mice that would not show a placebo effect. We took a group of mice and exposed them to unpredictable chronic mild stress. This paradigm includes a different type of stress that change every day for 1 month. After the stress, we treated the mice for 3 weeks, and after that, we did the behavioral tests. One of the behavioral tests that we used was the elevated plus maze. This is a maze with the 2 arms, one is open and the other is closed. And normal mice are curious, going both to the open and the closed arm. Mice with anxiety stay more time in the closed arm because it's safer there. We separate the stressed mice into 7 groups and put them in the elevated plus maze. As you can see in the results, the Cartagus panatifada in red and the lily bulb in yellow show the less anxiety behavior, which means this herb works well against anxiety. We will look at the activity of the mice to see if there were mice that had a decrease in their activity. As you can see in the activity results, all the mice act the same. That means that the less activity is not the reason that the mice stay for a long time in the open arm of the elevated plasmids. When we look at the depressive-like behavior, we use the tail suspension test. In this test, we held the mice from its tail for 6 minutes. Normal mice is move their body and try to escape. In contrast, depressive mice did not move. As you can see in the graph showing the immobility time, the mice that got the SSRI, the herbal mixture, and the Carthagus panatifada, the Shanza, showed the lowest immobility time versus the other group, which means the Carthagus panatifada helps with the depression. We also look at the brain-derived neurotropic factor, the BDNF. BDNF is a growth factor that involved in neurogenesis and creating a new neuron synapse. We know that after stress, the BDNF level decreases, and after antidepressive treatment, the BDNF level increases. So we focus on the hippocampal BDNF in the mice, and we found that in the mice, the Carthagus panatifada elevated the level of BDNF higher than the other groups. So we can conclude until now that the Carthagus panatifada worked well. We try to understand if the SSRI and the Carthagus panatifada work in the same biological mechanism. To answer this question, we did the in vitro experiment that expressed the serotonin transporter on Xynapus oxide. It's a frog eggs. We infused into the serotonin transporter SSRI or the herbs. This experiment found that the herbs, and particularly the Carthagus panatifada, do not work in the same biological mechanism as the SSRI. As you can see in the graph, the SSRI yield the maximum effect and connect strongly to the serotonin transporter. Just a minute, I pointer you, it's here. In contrast, none of the other herb had any effect on the serotonin transporter. We were worried that in the in vitro experiment, the period of exposure to Carthagus panatifada was short, but in the real life, patients need to take the Carthagus panatifada for a long period. So maybe the long period used Carthagus panatifada change the response or the level of the serotonin transporter? To answer this question, we look at the prefrontal cortex area of mice after they were treated with herbs or the SSRI for 3 weeks. We found that the level of the serotonin transporter decreased only in the group treated with the SSRI. You can see it here in the black, and not in the other group. That means just SSRI connect to the serotonin transporter and can change its level. So if the serotonin transporter is not the target of the herbs, is there another target mechanism? To answer this question, we made another in vitro experiment. We expressed serotonin receptor type 5-HT1A on Xynapus oxide. When we infuse serotonin on the receptor, we got the maximum response of the receptor. You can see it here in this bar. When we exposed the receptor to SSRI, we did not get any effect because SSRI was not activating the receptor. You can see it here in the graph. When we expose the herb, we can see a mild response of the receptor. Moreover, a new unpublished result we got recently found that Carthagus panatifada influence one other serotonin receptor type 5-HT2C. That means the mechanism of Carthagus panatifada may be differ from the SSRI. More unpublished results found that Carthagus panatifada also influenced the dopamine system and its receptor type D2. Okay, Carthagus panatifada work best, but if it causes side effects when using it, what will be the benefit of this treatment? To answer that, we took a new group of mice and exposed them to unpredictable chronic mild stress. After the stress, we separate them into 4 groups and treated them for 3 weeks. We observed their sexual behavior and their weight gain. As you can see in the graph, all the groups had the normal sexual behavior. Only the SSRI group had decrease in the sexual behavior. You can see it here in the black. When we look at the weight gain, we found that only group had any weight gain was the group that received SSRI here. From these results, we can learn that Carthagus panatifada does not have any side effects like SSRI. Mice results are nice. But what about humans? The next step was a human clinical trial. We did a 2 small clinical trial. In the first study, we used a small group of hospital patients from Mazor Psychiatric Hospital. This is in the north of Israel. We did a double-blind experiment. One group received placebo, and the second group received Carthagus panatifada for 6 weeks. As you can see from the results, patients who received Carthagus panatifada show significantly reduced symptoms of depression after 6 weeks of treatment versus patients who received placebo. This is after the 6 weeks. This is Carthagus, and this is the patient that received the placebo. We did not find any other side effects in these patients. These results permitted us to do a larger clinical trial with 67 patients that suffered from anxiety and depression. We admit patients from a social network. We ask for patients with anxiety or depression that had not used SSRI or cannabis. The patient in our double-blind study over a period of 12 weeks were checked through 2 phases in the experiment. They received a placebo or Carthagus panatifada for the 6 weeks in the first phase. The second phase was open label study with all patients receiving the Carthagus panatifada for the last 6 weeks. Blood samples were taken and a psychological diagnostic was made every 2 weeks. This clinical trial results show that the patient who received Carthagus panatifada treatment showed faster relief from the symptoms versus a patient that received placebo. When we look at their sexual behavior, we found that the patient that received placebo reported problem in their sexual behavior versus patient that received Carthagus panatifada that did not reported this problem. The placebo is in red. But this is important. When we switch the placebo to Carthagus panatifada in 0.5 after 6 weeks, you can see their sexual behavior was improved here. It is important to know that we didn't find any difference in the blood sample weight or blood pressure between the placebo or the Carthagus panatifada groups. In article we published 1991, we asked people who used SSRI if they had side effects, and if so, what they were. 40% reported weight gain, and 36% reported decreased sexual behavior. When we ask the same people about replacing the SSRI with the new herbal treatment with tested scientific background, we found a significant number of people who were willing to replace the SSRI with the herbal treatment. So if we summarize this lecture, we found that Carthago spinatifada work well against anxiety and depression without side effects. The mechanism is unknown yet, but we know that Carthago spinatifada influence serotonin receptor 5-HT1A and 2C, but not the serotonin transporter like the conventional SSRI worked. We also know that Carthago spinatifada elevated the BDNF level in the hippocampus, and this herb does not create side effects like decreased sexual behavior and weight gain. Moreover, we know that Carthago spinatifada is safe and helped in anxiety and depression in humans. I want to thank you very much, the organized committee, to invite me and to give me the opportunity to give this lecture by Zoom. My lab team, thank you, and the collaboration and all the foundation that support us. Thank you very much for listening.